Hello, my name is Gay Cook, and I'm going to do a focused cardio assessment on a patient, 53-year-old male patient, come in with complaints of angina. Thank you.
I understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Hello, sir. My name is Gay, and I'm going to be the nurse taking care of you today.
Okay.
I want you to be telling me a little bit about, you want to just lie back here for me?
Okay.
Tell me a little bit about what's going on tonight.
Well, my wife and I started exercising recently. We've been pretty sedentary, and we decided that we'd probably feel better if we started exercising. We're both in our 50s. I'm 53, and she's just turned 52. And we've been doing this for a couple of weeks, and last night when we got home after exercising, we exercised for about an hour. I started having pains here in my chest, and eventually they went down and my arm started hurting.
Okay, all right.
So we just felt like it was better to get it checked out.
Absolutely, absolutely. On a scale of 0 being no pain and 10 being the worst pain you've ever been in your life, you tell me about where this pain is now.
It's probably a 7 or 8.
Okay. Have you done anything to help relieve that pain?
Well, just to try to, relax and take it easy.
And does that seem to cause the pain to go away a little bit or get better?
It helped it a little bit.
Okay, all right. I'm going to take your blood pressure here now. So give me just a minute.
Okay.
Okay, your blood pressure is 132/100. That's a little high on the bottom. So I'm going to be listening to you and talking to you about a lot of things here for the next little bit, okay? First of all, tell me a little bit about your lifestyle. What kind of foods do you eat?
Well, we probably don't have the best diet in the world.
Okay.
We do eat some home-cooked food, but we do eat out, once or twice a week, and we don't really eat, we don't take pains to eat healthy.
Okay. Do you smoke?
No.
Do you drink alcohol?
Occasionally.
Occasionally. Tell me about the medications you take.
I take a Paxil generic for anxiety, and I take Hyzar for high blood pressure.
Okay. Do you take, and this is very important that you answer this correctly, do you take any kind of street drugs, marijuana, anything like that?
No.
Okay, all right. So I'm just going to be looking at you here and checking on some things. I'm just going to be looking at your neck here. You can hold your head straight, it's fine. I'm just seeing if any of the veins in your neck are standing out, okay?
Okay.
So I'm going to be just pressing in here.
Okay.
Good. And I'm going to be pressing in on this side. Okay, and now I'm going to be listening to you, so this will take several seconds for me to get done with this, okay?
Okay.
Okay, can I get you to set up, please?
Sure.
Take a breath for me. Okay, let it out. going to be checking your pulses here. I'm going to check this pulse down here. And I'm going to be checking this pulse up here. Do you have any swelling? Notice any swelling in your feet and legs? None?
No.
Okay. Tell me a little bit about your family history. I'm talking about your mom, dad, grandmothers, grandfathers, brothers, and sisters. Anybody in the family have any heart disease?
My maternal grandmother on my mother's side.
Okay.
Yeah.
Okay.
Now she died of a heart attack.
Okay.
She was,
Was she older or younger?
no, she was older.
Okay.
I'm trying to think. She was born in 1907 and she died in 1986.
Okay. All right.
And my mother's complained of feeling like she had heart issues. And she was hospitalized at one time. I think it was like the lining of her heart or something like that. Some issue there.
Okay.
What else? My older
Brothers and
brother-
sisters, yeah.
older brother has had a heart stent put in.
Okay. Now, about,
And that was recent. He's like 63, and he was probably 61 when he had that done.
okay. Okay.
And the only other person I can think of is my oldest sister. She had some veins cleaned out or worked on in her leg.
Okay. Now, have you ever had a stress test?
Yes,
Yes, and that proved to be okay?
it was okay.
Okay, tell me about your stomach here. Do you ever have indigestion, heartburn, or anything like that?
I've never had heartburn.
Never had heartburn, okay. Let's see here. Let me see if I can come up with some more questions for you. We're going to be running a whole series of tests on you, but I want you said that the pain in your chest was like, you describe that for me, please, again, one more time.
Well, it's like it's like that my chest is heavy.
Heaviness, okay.
And the pain, it shoots, it's like it shoots down this left arm.
Okay, all right.
And, it can be pretty bad.
All
Right now, it's not quite so bad, but, it was pretty bad when my wife and I decided to do something.
Okay. All right. So that completes our focused assessment on the cardiovascular system for this patient.